Welcome to the Learning Lab. My name is Roman Garcia. Today what we're going to be discussing is we're going to go over a case that will illustrate some of the difficulties associated in medical centers with patients who come with pain in one knee, but when the x-rays are taken, it demonstrates or it shows that the joint that has the most arthritic changes is not the knee that is hurting, but it's the knee that is not hurting. This has been a long unknown in the orthopedic setting, where the explanation of how it could be possible for somebody to have arthritis in a joint and not experience any pain. So what we've done is that in order for us to try to map out or try to determine what are the causes or explanations of this phenomenon that is often seen in the medical orthopedic domain, we've tried to objectify or to characterize the causes or the reasons as to why this phenomenon is so prevalent in the orthopedic domain. And one of the problems is that the orthopedic or examiners are not able to explain this phenomenon is because most of their diagnosing is done through visual observation of an x-ray film or an MRI or some kind of diagnostic exam. So they're basically exposed to a condition, yet only have one set of data to work from in order to explain what they are perceiving in front of them. So what we have learned is, in order for you to, or for a medical center to explain or define some of these abnormalities or these paradoxes that are seen in the medical center, you really have to create data points, multiple data points upon which you can use in order to formulate an entire picture. And you have to use data that comes from many different disciplines, such as chemistry, physics, biotechnology, etc. You have to use many different disciplines, sister disciplines, and combine all these different data points. It's the only way that you can really explain these paradoxes that are seen in the orthopedic center. And one of the benefits of having such a medical model is that you're able to gauge the results of your intervention by following these very same data points, which are objectable and based on mathematical formulas or physical principles. So what I'm going to do first is I'm going to show you the x-ray of this particular case. I'm going to come right over here. I'm going to turn off the light. Now, this patient came to us. She was a middle-aged female. She came with pain in her left knee. This is the left knee right here. She came with pain in the left knee. The right knee was completely symptomatic free. In other words, she had no pain in that right knee. So what we did is, I did the physical examination first. The physical examination revealed that she was experiencing physical signs of stress accumulating on the left knee, in the left knee, on the medial compartment, this area right over here, on this side right over here. The lateral compartment, this outside part of the knee, had no physical signs of any duress occurring in the soft tissue. But when we saw the x-rays, it was clearly, and I think you can appreciate it over these geometric figures, you can appreciate that the right knee on x-ray and through visual perception, the right knee is or has greater degenerative changes than the left does. Yet the right knee was symptomatically free. It did not bother her. The one that bothered her was the left. Now, if you will go to a regular medical center, orthopedic center, they would take an x-ray and they would evaluate based on the x-ray image. And they would flat out not understand what's going on, or they would not be able to explain why the right knee was symptomatic free. because they're using simple observational data points. They're not using any other data points. They're not collecting any other data points. But what we do is we utilize physics principles in order to explain, or at least try to explain, what we believe is the reason why this individual is experiencing pain on the less traumatized joint. And the simple explanation is that she uses the left leg more as a weight-bearing support structure than she does the right knee. Now that's an easy conclusion that anybody can have, and we're not the only one that has a conclusion such as that she puts more weight on the left leg. Now the key is how can you prove it, that the left leg is the greater support structure in this patient? And that's what I want to show in this video, how it can be proven through these geometric figures that we have discussed before. Now, when we did the x-rays, we established our vector lines. And you can see that the left leg, the weight-bearing structure, this line right over here, is different than it is on the right one. The right one shows that the right knee is in varus, or is in bow-legged. The left knee is not as much as in bow-legged. It's actually moving into valgus. It's moving this way. And you can see it by this space right here. You got greater space here between the bone surface over here and this vector line relative to this line right over here. So in essence, she's modifying her weight-bearing structure, her weight-bearing model, profile. In other words, profile is a better word. She's manipulating the weight-bearing profile of this left knee. Now, if we go to these volume triangles right over here, you see that there is a difference. If you observe this right, the one that shows more greater damage on an X-ray, you can see that this magnitude volume triangle over here is larger than it is on the left. The left is smaller, the right is larger. Similar to the lateral triangle magnitude volume triangle. It's smaller on the left than it is on the right. So in essence, what this means is that she literally has greater volume surface to tolerate her weight-bearing load on this right knee than she does on this left one. The volume, the surface tissue that's accepting her mass is less on the left than it is on the right. And this is important, and I'll show you why when I show you the formula that we utilize in order for you to actually visually see this patient and how she manipulates her weight-bearing load. That explains why she has more pain on the left than she has on the right. Because her left leg is her primary weight-bearing structure. She comes when she walks, she comes off real fast with this right leg, and she spends more time on this on the right leg. She comes off the right leg, and she experiences more time on her left leg than she does on her right leg. And you can see it clearly in these magnitude volume triangles right here. Now, this is what I want to do now. I'm going to come back here, and I'm going to show you the formula that we use in order for you to understand why these magnitude triangles are important. And they're basically what guides the medical center and their intervention as to if the intervention is working or not. Because as the patient gets better, those triangles that you saw on those x-rays, they're going to change and they're going to become symmetrical. Right now, she's asymmetrical. Her vector load is different and the magnitude volumes are different. That means that she's favoring one leg over the other. She's favoring the right, putting all the stress on the left leg, and that's what's creating this irritation of the bone tissue. Now, this is the formula that we follow. It's S is equal to M times V. S means stress. Literally, the stress that's being applied on the tissues. M means mass. This is the mass, the weight of the patient. V is the volume of the surface that's tolerating the mass, the weight itself. Now, this formula right here is very telling. And it pretty much guides our intervention. Now, the reason this formula is important and what this formula says is very simple. If we know that S is stress, M means mass, and V means volume. The only constant variable in this formula is the mass. This is the weight of the patient. Stress is relative to the mass times the volume of the surface, those triangles that you saw. So, in mathematical parlance, what we have is this. We know that the stress is equal to the mass times the volume. Now, we want symmetrical stress loads. That case that I just showed you right now, the stress is different. There is greater stress on the left knee than there is on the right. Now, we know this, and it has to be like that because the volume of the left knee is smaller. Is smaller on the left than it is on the right. On the right is higher. And what gives us this variable is those triangles. You can literally see it. The mass is the same. It's the same for the left as it is for the right. The stress is the key. Now, when you look at a formula such as this, no matter what it is that you're measuring, if one variable increases, the other one decreases. The two variables that are associated here and are inversely related, we have an inverse relationship, is the stress and the volume. Since the left knee, the volume is the volume in the left knee is smaller, that means that the stress has to be higher because the mass is constant. So by following this formula, our goal is to increase the volume of that left knee. So she has symmetrical weight-bearing loads on both sides. So let's say we were to put numbers to these variables by keeping in mind the inverse relationship between the volume and the stress. By increasing the volume, we decrease the stress of that left knee. So understanding this formula gives us a biological understanding of what is important and what needs to be manipulated in this particular case, since stress and volumes are inversely related. We increase the volume, we decrease the stress. The right knee has greater volume than the left knee. Thus, this volume on the right knee would be higher. Thus, since the mass is constant, the stress would be lower. I know it's a little bit tricky to understand this when it's presented in the first time like this, but the point is that when you're examining an individual's joint or really any part of the body, you have to take into consideration physical principles, especially if you're dealing with weight-bearing joints, because gravity is a very potent force that the body needs to manipulate in order to get from point A to point B. And if the medical center really doesn't have a good concept of physical principles and is able to introduce it into their medical model, you're basically experiencing a one-dimensional medical center trying to deal with a condition that's three-dimensional in cause. So the question is, was there any physical sign in this case that led me to believe that the left leg was, or the left knee was the one that was incurring greater weight-bearing load? And in this particular case, since it was an acute condition, the biomechanics was symmetrical on both sides. But there is a way that you can detect if a knee is the one that's incurring the greatest stress while the person is bipedal. And what I'm going to do is I'm going to show you what that is. and with my help of my assistant, Anna. So what Anna's going to do is she's going to lay down. Now, I've examined Anna's knees many times before, and biomechanically sometimes they have not been symmetrical. And what I mean by that is that you want symmetry between the right and the left. All symmetry means is that both joints are moving through the same axis of rotation. That's what symmetry is. And that's what this case that I showed you on the X-ray was. It was symmetrical in the sense of biomechanics, only because it was in an acute stage. But in most cases, when a case comes to us, it's already chronic. So there are asymmetries in biomechanics. And the biomechanic asymmetry that you're looking for in order to identify which knee is under duress is very simple. It's the knee extension. Just extending the knee. Extending the knee. You should always experience, or you should always observe and feel and sense the knees, relaja. The knees extend equally without any deviation one from the other. A ver, empuja para abajo. Relájame. Con esta nada más. Relax. Relájame. Con esta. Relájame. Con las dos. Relájame. Okay. Okay. So basically that's what you do. You're trying to detect extension. That's what gives you. That's what tells you which knee is under greater duress. Relax. Now as you can see, she has hyperextension, and it's pretty similar. It's pretty similar. There's some telltale signs here of this knee having some greater stress than the right one does. Her popliteal fossa is very congested back here laterally, as is on the right, but more so on the left. Now remember, we've always identified Anna as being not knee. So this lateral compartment over here is always under some greater duress than the medial compartment is. But in essence, that is how you detect if one knee is under greater, it potentially is the greater weight-bearing leg used by the patient, is this lack of extension. If the person has been walking for prolonged periods of time under an asymmetrical condition, the knee with the greater support responsibilities will tend to have greater congestion in the knee and thus less knee extension. And that is how you tell. So the interesting thing is that that's a general rule. It's a rule of thumb, but it doesn't always apply, as it did not apply in this particular case. And the reason, in my opinion, is that we saw her very early in the pain cycle, which it was a fact that she had only been experiencing pain on the left knee for the last three months. So she went over the threshold of inflammation that she became symptomatic. Most people, by the time we see them, they've been already far longer than 3 months with this pain in the joint. But eventually she would have experienced, she would have demonstrated some biomechanical flaw. But the point of this video, and what I want you to take away from this video, is that when you're doing a physical examination on a weight-bearing structures, you really have to use many information, principles, rules, laws from other disciplines, and amalgamate them, mix them, create a hybrid medical model that utilizes these principles from different types of disciplines. It's the only way that you can really create a three-dimensional characteristics of what's going on, which eventually is what guides you and tells you if your intervention has been successful or not. Again, anybody that watches this video, if you have any questions, if you want to contribute to the debate on what I say, if you have an opinion, make yourself heard. You can always contact us on the video, and I always leave contact information on the video. Thank you very much. Until next time.